Hello, this is Dr. Shemin speaking. We're going to discuss your thyroid surgery, before, during, and after. The plan is to take out your thyroid. This is the thyroid where it sits in your neck. It either has a tumor or it's enlarged like a goiter, or it's inflamed and causing compression. And those are the reasons that we're going to be removing your thyroid gland. Now, let's discuss what's going to happen before the surgery. First of all, you're going to have a medical assessment a week or so before the surgery. That is to make sure your heart and lungs are functioning normally. You'll also have blood work and an EKG and possibly a chest x-ray done at that time. 3 days before the surgery, you'll have COVID-19 testing, including the PCR and the antibodies. All of us in the operating room are also checked for COVID-19 so as to ensure your safety. The night before the surgery, you should eat your normal meal. After midnight, nothing to eat or drink except for a sip of water with any essential medications. Now, in terms of the medications, we don't want you to take any blood thinners or vitamins. We give you an entire list of medications you should avoid, and the reason is that if you take one of those blood thinner medications, there's a probability of your getting a hematoma or a hemorrhage after the surgery. So we certainly don't want you to take any blood thinning products for several days prior to the surgery. The morning of the surgery, you should take essential medications such as blood pressure medications that morning with just a sip of water. When you come into the hospital, once again, nothing to eat or drink after midnight, the night before the surgery. You'll be coming into the hospital where the nurse in the pre-op area will check you out to make sure that everything is in order, namely your blood work, your EKG, chest x-ray, all the preoperative clearance work is in order. They will also check to make sure about your consent form, which has to be included in the chart. We discussed the operation in the office, but we'll also have you sign consent right before the surgery. You'll also be visited by the nurses from the operating room. You'll also be visited by the anesthesiologist, and any concerns that you have regarding the anesthesia during the case, you can address at that point with the anesthesiologist. If you have had anesthesia in the past and have had issues following anesthesia, I would highly recommend that you speak to the anesthesiologist and draw their attention to these facts. During the surgery, as I mentioned, we'll be taking out either a half or the entire thyroid gland. We've discussed in another video the issue of the recurrent laryngeal nerve that supplies the voice box. During the surgery, we're very careful to position you properly on the table. If you have issues with your back, let the operating room nurse know. We also tuck in your arms to protect your arms. We tuck in your legs to protect your legs. You're wearing a strap to hold you on the table, and we do everything everything possible to ensure your safety during the procedure. More than likely, you will have a tube going down your throat, and that is to administer the general anesthetic. You'll also have an IV. That is a line put into your veins in your arm, and that is to administer, again, the intravenous anesthesia. When you wake up, hopefully you should have no nausea and no pain. We go to lengths to ensure that you don't have any pain when you wake up from the surgery. Please do not pull out any of these lines that are administering at this point fluids, because you do need the fluids both during the procedure and after the procedure, and those are administered by the IV. Once you are fully recovered from the anesthesia, we will give you something to eat and drink. Now, depending on the extent of the surgery and your underlying conditions, you may stay in the hospital overnight, or you may be discharged home that day. Either way, please recall that I do not want you to have any water over your neck incision. The neck incision is low down in the neck. It's horizontal, like in this fashion. We don't want you getting any water on that area because that could then lead to an infection. So you may take a bath after the surgery for a week. After the week after we address the wound, make sure everything is in order, you'll be allowed to shower. If you want to wash your hair during that first week, please lean forward and wash your hair in the sink. You want to be careful not to get any water on that neck incision. Finally, with regards to positioning, feel free to move your head to either side or downwards. Do not lift your head up like this towards the ceiling for that week, and it's even better if you don't do it for the month. And the reason is you don't want to stretch that incision open. If you put your head back, for instance, if you go to the beauty parlor and put your head back in the sink, you will stretch that incision and it will look somewhat unsightly. We want to avoid that. Therefore, what we encourage you to do is, again, side to side and downwards. You'll be obtaining a cream from us afterwards in order to minimize that incision to allow it to heal perfectly. You should also avoid sun on the area for a year. If you are going out in the sun to work on your garden or to play tennis, please put sunscreen or sunblock over that area, and that's for a full year. Depending on how much thyroid is removed, you may or may not require thyroid medication afterwards, and that again remains to be seen. We will check your blood work 1 month after the surgery to see if you in fact need the hormonal replacement. Also, you should note that there's very minimal pain in the area of the neck after the surgery, because we go to lengths to avoid that by giving you medications during the surgery. You should be able to resume work within 4 or 5 days. Certainly the outer limit would be about a week. If you have any further questions, please give us a call at 212-472-8882. And once again, I invite you to visit our website, nyheadandnecksurgery.com. That's nyheadandnecksurgery.com. Thank you and have a good day.